Personal responsibility is very important in any area of life, right? And this is another one of them. On the other hand, we watch out for each other. And sometimes I have to remind my wife it's time for this exam, it's time for that, because I care about her. So again, caring about each other and wanting to be healthy for someone else is pretty powerful. And it's oftentimes we won't do it for ourselves. We're fairly fatalistic in many of these things. But when we realize we have other people that we care about, we want to do it for them.
Studies show men are twice as likely to go 2 years between doctor visits, and 40% only go if they have a serious issue on their hands. So what keeps men from seeking routine medical care, such as an annual physical? Men say it's because they have a busy schedule. However, according to a study by Harvard and Rutgers, men who self-report traditional views on masculinity are less likely to get consistent health care. Men also report a fear of diagnosis and being uncomfortable with exams that's keeping them from seeing a doctor more often. On today's Sound Living, making men's health a priority. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Elaine Johannes, the Kansas Health Foundation Distinguished Professor of Community Health at Kansas State University, and Brad Dirks, a behavior health specialist with K-State Research and Extension and Associate Director of the Physician Assistant Program at K-State, says society's norms, that of telling boys to brush it off, walk it off, or don't cry, make it more difficult for men to take care of their health. Brad, as we talk about men's health, one of the things we were discussing before we started recording was the fact that men are very hesitant to take care of themselves.
True. Yes, I can speak from experience on that. It is not something that comes naturally or something that is in the forefront of our thoughts. And usually our care is, thrust upon us, either by necessity out of an illness that we can't ignore, or by a family member or someone who's well-meaning who goes past the nudge to the nag level of, you get this fixed, or come with me, go with me, let's look at this.
And some of this is really cultural, the fact that men are hesitant to seek help?
Absolutely. We're told to just brush it off or walk it off, don't cry, don't show your true feelings. And so particularly when we talk about health and even mental health, those symptoms that would ordinarily be evident is different in men. So signs and symptoms look different because we ignore it for quite a while until it becomes something that we can't ignore.
Elaine, you're married. How does this work in your family setting?
Well, both of you are speaking to my heart. I've been married well over 40 years, and it's hard to see the men in our lives not take care of themselves. And it's hard to also know when to intervene, when to remind, when to nudge, when to nag. And I am more and more concerned that the men in our lives are pushing so hard to provide, to maintain the stamina that maybe they all had when they were younger, and also just the cultural burden, I think, that men take on to always be there. So it is a reality. Women do make most of the decisions in the family's health, I think. I think we probably still make decisions on when we need to get our vaccination or when we need to go get our checkup or the colonoscopy, or does the health insurance pay for this or not? So, it's a team effort. And I think the women listening in should know that it's a team effort with our men.
Well, and there are a lot of different health risks, not only for men and women, but in particular for men, you've got 5 top concerns.
Right, particularly with the cause of death. The number 1 is heart disease, obviously. Number 2 is stroke. Third in that list is suicide. And that is a stark realization when you think of that's number 3. And then prostate cancer and lung cancer is the kind of the top 5 in men's health as far as cause of premature death.
And really none of those are something that might have some pre-existing conditions.
We know there's genetic links, and those are the things that you cannot control. You can't control your genetics, and you can't control your male-female genetic code. So those things would put you more at risk, depending upon the illness, of course.
So what we're looking at here then are some screenings and making sure that we're doing those yearly physicals?
Absolutely. Controlling those risk factors is the key. And when we talk about that, there's some significant risk factors that may hit all of those. Smoking is a risk factor for almost all of the top 5. Cholesterol is certainly with heart disease and stroke. Controlling your blood pressure and your weight, your activity, and looking at your blood sugar. So those are risk factors for those top 5 that we can control.
I think I remember a statistic that said something about if you're a smoker, you will live on average 7 years less than you would have if you hadn't smoked. Is that still true?
You know, those numbers tend to change, but certainly there's some real truth to that. And the smoking impacts your heart. It impacts your lungs. Almost every cancer is increased by smoking, not just lung cancer. Many of the cancers, smoking is a risk factor for that.
They also talk about the fact that with cholesterol, a change in the diet, just a small change in the diet, might help lower those numbers.
I like to think of cholesterol and weight, hypertension, again, as a whole. My thought is you want to be healthy, your lifestyle, and that includes several different things that you can do. Weight control is a matter of portion control. It's what you eat. It's how much you eat and the sugars that we take in. And we have exercise that we need to do. So again, a lot of those top 5 are impacted by your sugar, your weight, your blood pressure, your cholesterol. It's all tied together. So if your diabetes is out of control, your cholesterol is going to be high as well. We're discovering more and more links between these illnesses and the risk factors that contribute to them.
A lot of times in Extension, Elaine, we talk about that if we can get people started on doing certain things early on in life, does this apply, you think, in terms of maybe the men's aspect, in terms of getting more health information?
I think so, Jeff. I think women, we talk about things. Women, I think we talk about pregnancy and we talk about our reproductive health and we talk about our obesity, menopause. I mean, we talk about it. I don't know if men talk about their health. And I think the more men are familiar with noticing their health when they're younger and then being willing to open up and talking about it, not necessarily with a mom or a wife, but even with their peers. I think some of these terrible diseases and issues that Brad has shared this list with can be dealt with a step at a time. They don't have to get to this extensive condition, but the men have to talk about it. So from a woman and a co-worker perspective, how do men open up the discussion with other men about health? I don't know if there's words that are used like courage and bravery and go get it checked. You know, I don't know how. I don't know.
How do we work that in between our football and baseball and basketball conversations, right?
Tough to work your prostate into a football conversation. But, you know, I think part of it is starting early and training young men. And, again, if it's modeled by your father, that gives you permission. And we know that you need to start early on with blood pressure, with blood sugar, checking your cholesterol as young as age 20. And then if it's okay, you can go, a period of time. But if there's a family history of problems, and that in itself is a motivator, if you have cancer, if you have heart attack or stroke in the family, there's more of an impetus to really be careful and check the blood sugar, the blood pressure, the cholesterol earlier on. Because with those family histories, that means you're more at risk and that you need to pay closer attention early on. So those can be motivating factors to say, hey, your grandfather had this, he passed at 56 and your father struggled at this age, so you need to take care of yourself. And that's one way I think of motivating men. The other part is realizing that you have people in your life who love you and care about you and you care for them. And so going into that and just pointing out, it's really powerful when my wife says, hey, you have grandchildren. You need to take care of yourself. They love you, and they would be really impacted adversely if you were not here.
Insurance companies are also catching on to the fact that if we do some things preventatively, that can avoid some big bills for them down the road and problems for us down the road.
I think health insurers are similar to what Brad had talked about earlier, that they're getting smarter by keeping us healthy, they don't have to be paying out these very high claims. I'm perplexed, though. I know the preventative screenings that I have through my health insurance, and my husband, I think, has some preventative screenings. But, I don't know how to nudge or nag that too much. I'm on a schedule. My doctor calls me, and I've got my mammograms all set up and all that good stuff. But honestly, in our discussion today, I am curious, what have I not nagged about?
Good question. I think you've nagged about so for me, okay, I have a family history of blood pressure problems, and I'm on a blood pressure medicine. So the doctor says, okay, I have to see you every year. We have to draw a blood panel, and we have to check intermittent fasting. We have to check your cholesterol, all of those things. So it's like I won't refill the medication if you don't come in and get those tests run. You don't get any more medication. So then I have to come in. So that's why I say most of this is thrust upon us in some form or another. When it comes to like a colonoscopy at age 50, most of us, that's not something we would sign up for voluntarily, but it's something that needs to be done. And in fact, if you have prostate cancer younger, it's more aggressive. So it's very important to catch it early. And that's just another example of a cancer that the sooner you catch it, the better off you certainly are. We need to understand that most insurances do provide preventative things. We've talked about prevention for a long time. We really have. I'm not sure we're getting any better at it. But we know that is there. I have preventative dental care, preventative yearly physicals, and you go in, and if you make that part of your routine. And again, my wife will say, okay, I've signed you up for this. Your appointment is Monday morning at 8 o'clock. You go in fasting. And if you won't go, I will go with you, and we'll walk you into your. So things like that continue to, be motivating factors.
I do recall drugstores, pharmacies are also part of this system now. Not only does our physician call us that, hey, I'm not going to renew your prescription unless you come in. I think pharmacists do that now too. They kind of weave together the different kind of schedules. And so the pharmacist is part of the team. Brad, you and I work in a lot of rural mental health, and now I'm thinking about the men who live in these very isolated rural areas, and they may not be insured. They may have to drive in someplace, go to a safety net clinic or an FQHC, and that's uncomfortable because they may not know who their provider is. They may not feel that they could actually talk about things because they don't know who's there that day.
There are different organizations that come through and provide like cholesterol screening for a minimal cost. And most pharmacies will have a blood pressure station that you can go. You walk in there, you buy something else, take your blood pressure. Just find out what it is. So again, there are ways to do it, but that is a factor. The lack of insurance certainly is a factor in this healthcare.
I kind of think what I'm hearing you say is just like so many other things, we have to take ownership of our own health. If we want to stay healthy and be healthy, we need to take the steps necessary to do that.
Personal responsibility is very important in any area of life, right? And this is another one of them. On the other hand, we watch out for each other. And sometimes I have to remind my wife it's time for this exam, it's time for that, because I care about her. So again, caring about each other and wanting to be healthy for someone else is pretty powerful. And it's oftentimes we won't do it for ourselves. We're fairly fatalistic in many of these things. But when we realize we have other people that we care about, we want to do it for them.
That's Brad Dirks, a behavior health specialist with K-State Research and Extension and Associate Director of the Physician Assistant Program at Kansas State University. Elaine Johannes is the Kansas Health Foundation Distinguished Professor of Community Health at K-State. More information on healthy living can be found at local Extension offices as well as on the Extension website, ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.